morning to all of you. This is Suresh Bhagia from Ahmedabad. So, I introduce myself as a human being first, Suresh Bhagia. I don't say Dr. Suresh Bhagia. Because I have that holistic element in me. And that is what prompted me to start this kind of a program.
Yes.
Like going against the flow in a way. And even though I'm doing surgery, it is like in a way against surgery. So, but then I could see the results coming in after COVID, especially. So that is how I started the program. I'll take you through a journey and let me screen share. So bypass like bypass surgery को मालूम है, bypass operation. तो मैंने बोला bypass the bypass. And what can be better than a bypass surgeon telling the people that you can bypass this operation? Humbly speaking, I have traveled all over the world and I have got a huge experience in the US, UK, New Zealand. I have done surgeries everywhere, trained and done heart operations everywhere. Many charitable missions also in PG, Mauritius. So a charitable element भी है अंदर, which gives me fulfillment and enjoyment. And short story. Normally, the academic guys give the certificate or gold medal to the topper. So I topped in 2003 in heart surgery in India. The vice chancellor of National Board Examination was supposed to give the gold medal, but Abdul Kalam came to greet Mata Amritanandi Mai in Kochi, that lady who hugs everybody. So he said that now I will give the gold medals because he loved students. So by chance, destiny below accident, whatever was supposed to be, so he gave the gold medal. So the whole scenario changed in 1 month. Instead of the academic vice chancellor giving a gold medal, President Abdul Kalam. Or usme bhi photo is good because when he gave the certificate, he lost my certificate. It was written Manoj Babu. I know I'm not Manoj Babu. Well, that don't worry. You wait here. I will find it and then only you go from the stage. So उसने 2-3 minute बात की तो there were like 20 photos. This was all destiny time. And I have worked with the pioneers like in the world. So Michael DeBakey, the first guy to do vascular surgery, Denton Cooley, pioneer in heart surgery in the USA, first heart transplant in US. And Magdi Akub again, first heart transplant in UK, Egyptian guy. Carlos Duran, he made several things for heart valve repair. So, as I told you, you asked me before the thing, that I have seen very bad coronary disease. Sometimes we cannot even do the surgery. So I said, why not avoid it? So I said, let's try something, this one. And as I said, in Corona, people were getting better without intervention. So I said, let us explore more. Here I spoke with this fellow also, my mentor now, Dr. Aldwell SLC. So I had several sessions, Zoom meetings, that what should I do? He said, you carry on. I think it will change the people's perspective and it will be a long way to go and you will face resistance, but you carry on doing and I will help you. So he said, you can use my data also and carry on. That was inspiring, that such a big guy and 20 years studies, that he has been able to reverse heart disease. It is actually on angiography, not like any Baba saying, so he has actually changed the So this is just some statistics. Everybody knows the heartbeats kitna hota hai, and its average heartbeat is like 80 times per minute and like that. And I am an ordinary human being. Then I became a doctor and then became a heart surgeon. And it was my dream to work with Dr. Cooley since school, 6th, 7th standard. And fortunately, I could land that. So uh, also, I am a musician and I love heart surgery and I do yoga, aerobics, meditation, and I do follow a nutrition plan, which I will explain to you in brief. And mission is to help. This was 1 million. Now I think it will be 10 million people. So, and vision is to empower the entire generation and make them doctors, self doctors. So they don't need to go anywhere. They can do their own medicine. So we have started a program called diet, meditation, and exercise. So I've taken a trademark and like TM, and this will be like exclusively for people to join. Very soon, one application also will be launching, so people can get some benefits, and we can do hand holding also, maybe with Dr. Ranjan and Anna and all other people in the groups. Some yoga experts, meditation experts, nutrition experts. We can guide the people sometimes in group sessions or one-to-one and explain them the benefits. Uh, there is mindful meditation like heartfulness and so many other uh, meditation styles are there, Vipassana, and basically focusing on the breathing. And these definitely go a long way in reversing chronic heart disease or any other chronic lifestyle. And exercise again, there are different yoga asanas which help in reversal of heart disease. So main thing is nitric oxide. So nitric oxide is the most powerful vasodilator on earth. And so the nitrates that we eat are converted to nitrites and then into nitric oxide. So rich foods like that are palak or spinach, pudina mint, dhania, coriander, methi, fenugreek, beetroot, and all the greens like kale and broccoli and chard and bok choy. And so many greens are there. All have big content of nitrate, which gets converted by saliva into nitrate. Seeds are important because they give you omega-3 fatty acids. The ratio should be like 3 should be more than 6. And flax seeds and walnuts top the list in this. Very important thing is intermittent fasting. And if you can have like a 6 to 8 hours eating window, then that will be helpful. There are some superfoods which I came across and I experimented with the kind conversion of patients, and they were very helpful. So, like ashwagandha and the Arjuna tea bark powder, and apple cider vinegar, and lemon juice, and wheat grass. So, there are some powders available, and spirulina. So, they all help in actually reversing heart disease or like dilating the coronary arteries. And I have even seen heart pumping, go from 15 to 45% without any medicine or bypass surgery. Because some patients somehow are against doctors or against medicine. They have some revolting feeling that doctors are cheating or something. So they say that do whatever, but without medicine. I don't want to take medicine and no intervention. So they started this diet and they could increase the pumping. And up till now, no pharmacology medicine has been able to increase the pumping from 15 to 25%. Hardly 10% may. But these people had an increase in the pumping. And coronary CT angiography also showed the changes. Important question, which I will answer for you, that what about the calcified arteries? So even they are reversed a little bit, especially like vitamin K2. You supplement them with vitamin K2, CT coronary calcium scores changes, and angiography has shown reversal. So these results are proven, and currently I am into advising the patients for a vegan diet, but recently things are evolving, and there is a group which I'm interacting with, and they advocate cow ghee and olive oil, cold pressed virgin olive oil. So maybe I'm going to change the diet pattern a little bit and work on the patients that what is better for them. So I don't want to just like follow a fixed plan or dogmatic. Whatever works for the patient and faster, I will try to change. Basically, the aim is how to avoid bypass surgery, how to avoid angioplasty, and how to avoid medicines. And avoid, I am saying. So not stop or totally eliminate. Where necessary, we will do, because our group will be unique in the sense that I am not a Baba who does not have knowledge of medicine. If some people want or require medicine or surgery, I can do it. So that I think it will be a better thing than any other Baba in India or anywhere. So mindful meditation, you just count your breaths. 1, 2, 3, 4. Your mind stops. You focus only on the breath. I tell them that you focus that as you breathe in, you are expanding or dilating your coronary artery. As you breathe out, you can see that the blockages are going away instantly, and visualize the color of the blockage, yellow, white, something, and they are getting eliminated. So that is a very powerful meditation, and it does help. Paradoxically, I have seen those people who may be even eating junk food, but having a very strong mind, they reverse that disease. And some people, they don't have coronary disease because of a very powerful mind and always happy and smiling. So I still remember 150, 160 kg person, and he was eating every day fried chips, and we call it like papda jalebi in Gujarat. So he was having that, and I was thinking maybe he will need bypass surgery. When we did his angiography, it was double the size of normal coronary and all clean. So, and he was happy and smiling on the operation table, angiography. So probably this laughter and meditation can go even beyond diet sometimes. But currently, my focus is diet first. So 60-70% will be diet. Yoga again is a exercise, and now there are many other exercises which we have seen, which are useful for diabetes and reversing heart disease, like calf raises. Immediately 30 milligram percent lowering of the blood sugar. Just while sitting, you just do your heel lift and toes are on the ground, and do it 100 times. Blood sugar is down by 30 points. And without doing anything. And you can eat the meal and while doing it. These are some testimonials. If time is there, I can show you, but they are in Gujarati. So how the patients got benefited and they are still living happily without surgery for 1 year, and they have avoided bypass surgery. And some patients got a bonus that their diabetes reversed. Actually, they are without medicine now. 10-year-old diabetic patients, reversal was in 15 days, 1 month after following this. Yeah, so calf raise, gently lowering, it activates the soleus muscle. Any anti-gravity exercise, raising the hands above the head, lowering 20 times, 30 times, walking up the stairs. Anti-gravity exercises always will give very good results in diabetes, coronary block. And regular exercise, those who can walk, if they have knee joint pain, can go swimming or stationary exercises or bicycle. And this guy, Neelam Doctor, not a doctor, his last name is Dr. Neelam. And his EF was low. He had severe coronary disease, all the three vessels, right, left, marginal choke, 95%. He has been living comfortably since on simply diet, meditation, exercise, the three pillars. So now I'm going to make this like more spread and nationwide and international. And I will be conducting multiple Zoom sessions and digital app and website and everything, so that more people get the benefit. Because it's not that I want their money or something, but I can definitely change the lives of people and I can avoid their blockages because I got proof and I know I can do it. And moreover, I have a backup. If at all patients get serious, I can take them to my cardiology for angioplasty or surgery. And also, like our colleague is there, Dr. Chandana. So I have got a connection with like 900, almost 1,000 heart surgeons all over India. I can cater to all the people in India. Anybody who gets an emergency anywhere in Jaipur, Delhi, or Mumbai, they need a good heart doctor. I can refer to them. At least they will be ensured to get the right treatment and not get cheated. And I will start personal consultation also in selected patients, those who are not improving or